Dear viewers, welcome you all to our show OSA, that is Orthopedic Solution Academy. Hope you all are well with your friends, family, and patients. Before starting our program, I would like to say that yesterday we celebrate the Bengali Happy New Year. So I would like to say Shubho Navabarsho, that is Happy New Year to all of you. Dear viewers, we all know that the Ilizarov is the lighthouse in the dark sea. We can do many things by Ilizarov when we have nothing. Like that, the role of Ilizarov in obesity is a very interesting thing also. And today our topic is the role of Ilizarov in obesity. And the speaker is the one and only, the legendary Ilizarov surgeon from Bangladesh, Professor Mofakrul Barisar. I would like to request Professor Mofakrul Barisar to join with us.
Good afternoon.
Good afternoon, sir. We have three learned academic experts with us. One of them is Professor Novikov sir from Kurgan, Russia. I would like to request Novikov sir to join with us. Hope he will join with us in the coming part of our program. And we have Professor Omar Barabi sir from Kurdistan, Iraq. I would like to request Professor Omar sir to join with us.
Thank you so much. Good afternoon. Happy New Year. Thank you so much.
Good afternoon. Happy New Year, sir. And I would like to request Dr. Shamsul Huda sir, a very enthusiastic Ilizarov surgeon from Patna.
Very good afternoon. Thank you, Dr. Tanvir. We have a very interesting talk today.
Yeah. Thank you very much, sir. Now, I would like to request Professor Mofakrul Bari, sir. Sir, we can't see you, sir. Would you please join with us again? Professor Mofakrul Bari, sir, we can't see you, sir. Professor Mofakrul Bari, sir, you have to join with us again, as because of we can't see you now. And we are all waiting for your interesting topic, that is the role of Ilizarov in obesity. We are using Ilizarov in many cases, like the last hope. But what is the role of Ilizarov in case of obesity? I am also in mystery. What Professor Mofakrul Bari sir is going to present today, how he is using the Ilizarov in obese patient. Definitely, there is a role in Ilizarov, role of Ilizarov in obesity also. I think Professor Mofakrul Bari sir is again joining with us. Sir, can you hear me, sir?
I think sir cannot. Omar sir. Omar sir, can you hear us?
I can hear you.
Wonderful, sir. Wonderful. So today we have got a very interesting case that we have been doing laser and
interesting subject.
Interesting subject. Very interesting topic, sir. Yeah. Let's see how Bari sir has been dealing with this.
Do you heard about this subject before now?
Right, sir. No, sir, never before. That's why we are very anxious learning about this. I think they are having some network problem. We have to wait some time for some.
We are waiting. Okay.
Yeah, there is a network problem in case of Bari sir, and he's joining with us within a few seconds. So I would like to request Professor Omar sir. Sir, what about in your country? Do you use Ilizarov in case of obese patients? Sometimes it is very difficult to operate in obese patients.
No,
are you using?
No, we are not using. Some of my colleagues they are doing bariatric surgery, but none of us we are using Ilizarov.
Okay. And what about Dr. Shamsul sir?
Yeah, not yet. I've seen a role of Ilizarov and obesity. I think this must be related to how to use Ilizarov in obese patients for different bony conditions. So it's a
Yeah,
very
that
interesting
may be.
topic.
That may be.
Yeah, yeah. So we are very eager to know that.
Yeah, actually, the topic is a mysterious topic. The role of Elizarov in obesity.
Yeah,
It is a very attractive topic also.
exactly,
That's
exactly.
how we can
So today,
use the Elizarov in case of obese patient, in case of maybe in fracture management or maybe in other management of
exactly, because
bone-related management.
yeah, because applied Ilizarov and obese patient, we have to make special rings, bigger rings, and stability is very
Absolutely right.
important. Yeah, it's very important. So, sir, Omar, sir, what is your experience of using Ilizarov in different bony conditions in obese patients? Omar,
Really,
sir.
I did for one of my case failed total knee replacement. They did total knee replacement 3 times, and there was a gap of 10 centimeters between the upper end of tibia and femur. Then I did arthrodesis of the knee assisted by bone transport. In case of her thigh and upper leg, I used pelvic type of the half ring, very big one. I can send the photo of that patient because the maximum diameter of Ilizarov ring, which I have 240 millimeter. But that case,
Exactly.
it was 300 millimeters. So I used half ring of the pelvic for fixation of the pelvis. I will send the photo of that case. In the beginning, I applied bone cement plus Ilizarov frame. Then gradually I did arthrodesis assisted by bone transport. And preoperatively, I sent for CT angiography because I was afraid from the artery. There was a vascular surgeon with me. I was afraid if I'm penetrating the artery. But fortunately, it was safe. Then I did gradually. Now the patient is good. She was very obese, hypertensive, diabetic, and hypothyroidism. They did total knee replacement 3 times. So they create a gap of 10 centimeters in diameter. Okay.
That's
Exactly,
great.
sir.
That's a life-saving surgery, I
Interesting.
think.
Yes, yes.
Yeah,
Very interesting, sir. Because it's very
very
difficult.
interesting,
Even
sir.
after applying rings, we have to apply multiple rings, and actually we have to combine a bigger arc. And even after that, the stability of the ring is very important because in obese patient, because of the weight, it's very difficult to keep the stability.
Dr.
Uh,
Shamsuluda, please send me your phone number. Then later on, I will send you the photo of that patient.
okay.
Sure, sir. I'm sending in the chat box.
Okay. Okay, thank you.
I think Professor Mafakrul Bari sir has joined
I
with
think
us.
so.
Sir,
Yes.
again, welcome, sir.
Okay.
Yes, sir.
Now, can you
We are
see?
very eager
Can
to.
you see my
Yeah.
screen?
Yes, no, sir.
Yes, yes.
Yet not, sir. It's coming.
Okay,
It's
dear
coming,
friend.
sir.
Coming.
Yes, sir. Yes, sir. It's okay, sir. It's perfectly
Okay.
okay now, sir.
Okay. Okay.
Yes, sir. Okay, sir. Please proceed on, sir.
Okay. 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 Sorry for the interruption. The dear friends, today I would like to talk on the role of Ilizarov in obesity. So very interesting topic. So see, the war is going on in Ukraine. This is my institute. This is situated in Kiev. It's a very big institute where I did my MS. This is Tashkent. This is also Kiev Scientific Research Institute of Traumatology and Orthopedics. Still they are working. Every day I talk with my colleagues, those who are working there. So these are the things. And the obesity is a complex disease involving an excessive amount of body fat. Look at this right side gentleman. Just look. He was my patient, and it was very difficult to treat that gentleman. I'll show you later on. So obesity is not just a cosmetic concern. It is a medical problem that increases the risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. So how to tell if you are obese? The most widely used method to check if you are a healthy weight is body mass index, BMI. For the most adults, a BMI of 18.5 to 24.9 means you are a healthy weight. 25 to 29.9 means you are overweight. And if it is 30 to 39.3 means you are obese. So you can see here important to take steps to tackle obesity changes. It can lead to a number of serious include type 2 diabetes, coronary heart disease, some types of cancer, such as breast cancer and bowel cancer and stroke also. Now, what are the causes? Generally caused by consuming more calories, particularly those in fatty and sugary foods. Then you burn off through physical activity. There are also some underlying health conditions that can occasionally contribute to weight gain, such as an underactive thyroid gland, that is hypothyroidism. Now, other obesity-related problems. Obesity can cause a problem of further problems, including difficulties with daily activities and serious health conditions. Day-to-day problems related to obesity include breathlessness, increased sweating, snoring, difficulty doing physical activity, often feeling very tired, joint and back pain, and low confidence and self-esteem, feeling isolation from other people. Now, serious health conditions. You can see here, these obese people can increase your risk of developing many potentially serious health conditions. These are, I already mentioned, type 2 diabetes, high blood pressure, high cholesterol and atherosclerosis, metabolic syndrome, and several types of cancer, including bowel cancer, breast cancer, womb cancer, and gallstones. Of course, the osteoarthritic changes in the joints. And World Health Organization in 2020 described obesity has reached epidemic proportions globally, with at least 2.8 million people dying each year as a result of being overweight or obese. Once associated with high-income countries, obesity is now also prevalent in low and middle-income countries. Government, international partners, civil society, non-governmental organizations, and the private sector all have vital roles to play in contributing to obesity prevention. Now, there are 6 types of obesity. You can see here, food obesity, thickness due to nervous stomach, gluten diet, genetic metabolic obesity, and venous circulation obesity, and inactivity obesity. These are the 6 types of obesity. Facts about obesity. You can see here who globally estimated these things. Overweight and obesity are linked to more deaths worldwide than underweight. 39 million children under the age of 5 were overweight or obese in 2020. Obesity is usually the result of an imbalance between calories consumed and calories expended. Children's diet and physical activity habits are influenced by their surrounding environment. Curbing the global obesity epidemic requires a population-based, multi-sectoral, multidisciplinary, and culturally relevant approach. Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health more than 1.9 billion adults. You can see here, and eating a healthy diet can help prevent obesity. Maintain a healthy weight, limit total fat intake, and shift fat consumption away from saturated fats to unsaturated fats. Increase consumption of fruit, vegetables, pulses, whole whole grains and nuts. And regular physical activities are very important to maintain a healthy body. People should engage in adequate levels of physical activity throughout their lives. At least 150 minutes of regular, moderate intensity physical activity per week reduces the risk of cardiovascular disease, diabetes, and colon cancers. Now, you can see this picture, obesity treatment by Ilizarov. And the most fatty one, you can see, he is 80 kg. So these are the peoples that I treated. I was bound to treat with Ilizarov because no other options. And I'll show you, see, normal and overweight, that is normal configurations you can see of the rings and other parts. When you are going to treat with Ilizarov. So I'd like to share
I think Professor Barisar is disconnected again, and I hope he will connect with us within a few seconds. Please wait.
So, sir, as we discussed, it seems Omar sir seems the same thing. How to apply Ilizarov rings in obese patients, in bulky patients, sir? How do you stabilize the ring besides arches? More of rods, more of wires, more of pins, sir. What is your experience, sir, in these cases? Please unmute, sir.
Is it me?
Please unmute. Yeah, please.
Is it good? Okay.
Yes, sir. Yes, sir. Yeah.
With wires, and some of them really I combined with Shanspin. It means hyper type. A combination of both wire and Shanspins. I will send you the photo of the patient later on.
Right, sir. So as I feel, sir, single normal rings are not possible because you have to apply around 300 or 350 rings, or sometimes you have to make arches, combine arches, and make a conjoint assembly. Even after that,
Exactly.
maintaining the stability is very difficult because patient is very heavy. The rings become loose, the wires become loose. Maintaining the
Yes.
after applying the rings, maintaining the rings is very difficult. I've done in a few cases, and because of that, results are complicated, not very good. Takes time. It's difficult, sir. Yeah.
Yes, they have high chance of infection, pin tract infection also.
Exactly, sir.
Because their hygiene is difficult.
Exactly, sir. And even in the groin area, and because thick layer of fat layer is there. We have been seeing a patient with obesity breaking their nails, coming back with infections, and then have to after apply Ilizarov only.
Yes, even with plate and screw is very difficult.
Yes, exactly.
Because the field is very deep till you are exposing the bone.
Even the pin size, you need larger pin sizes.
Dr. Shamsuddin sir, I would like to ask one thing. Is it enough to give only 2 or 3 wires in case of obese patient, or we need much more wires comparative to the normal patient?
Yeah, that is actually a very important question. We have done in a few cases. Actually, with the ring size is not enough. You have to apply more a combination of ring and arches, make a bigger size, and then you have to apply pins, larger pins and wires. Barisar is back, yeah, please. Barisar, please.
Barisar, please, sir.
So now I'm visible.
Yes, sir. Absolutely
I'm visible
fine, sir.
now.
Yes, sir. There is a network problem there, sir.
Clear?
Yes, sir. Yes, sir. Yes, sir.
Okay.
Okay, sir. Please go on, sir.
Okay. Okay.
Okay, sir. Okay.
Right?
Everything is fine, sir. Please. Everything is fine. Please go on, sir.
So see the configuration of the ring, considering the size of the thigh. Look at this. So this is a very big, more than 240, 280, and 220 the size, ring size. 200. This is a 120-degree arch Italian. This is the big Russian arch, and combining of the two and long plates I've connected. If you think about the size of the whole thigh, very big. So regular rings you cannot find in the market. You should order that one looking the size of the patient's thigh, and he's 6'3" height. Look at the thigh. And then
I think the great disaster that Professor Bari sir is facing lots of problem. Sir, we can't hear you, sir.
So, sir, as we have seen in the picture that Barisar has shown us, he has to apply multiple plates, rings, wires, a complete complex assembly. Yeah. Please unmute, sir. Please unmute, sir. Like, yeah.
Yes, used Russian and Italian type of implant.
Right.
They need modification.
And you have, even after applying such a complex assembly, you have to keep your fingers crossed so that if it is stable or not.
Yes.
Yeah.
Yes, it is not easy. But patient factor is very important. If the patient is cooperative,
Right, sir.
it will be much more easier.
Yeah.
So patient selection and patient satisfaction are very two important factors in successful operation with Ilizarov.
This is the most important point: patient selection, patient satisfaction, and counseling of the
Satisfaction.
patient.
Yes.
Yeah, counseling is very important in these cases.
Exactly.
Then what about the weight bearing of obese patient?
We have to delay
Is
in
there
these
a,
cases because of the,
you have to
Better,
delay
yeah,
better to encourage early weight bearing as soon as possible.
as soon as possible, sir?
Yes.
to keep a very strong assembly.
Yes, yes, sir. That is the main important thing. Can this normal wear be able to bear that weight of that 200 kg people, 200 kg person?
Yes. I'm using hybrid technique, combination of wire and shunt pins.
That is a great thing also. Definitely, that is a great thing. Can you use the console wires in case of the obese patient? Dr. Shamsullah sir, would you please? Dr. Shamsullah sir, can you hear me?
I think there is some interruption. Can you hear me?
Yeah, I can hear you, sir. Please. I'm asking that in case of console wires, can you use that console wires in case of obese patient to get more stability?
Your voice is a little broken. Can you please repeat the question?
Can we use the console wires to get more stability in case of obese patient?
I don't think console wire role is very important here. We have to apply the complex assembly like pins and wires both, long pins. Multi-directional pins is very important because if we apply mono-directional, it will get loosened. Multi-direction wires and pins both are very important in these cases. Role of console wire depends. Yeah, not in all the cases.
Okay. Barisar is facing lots of problems in his network. Hope he will join with us within a few seconds.
Yeah, we'll be waiting.
Yeah, we are waiting for that. Uh,
In the meantime, we are getting this invitation for this Cairo function in September, buyout by Faisal sir. And the
Definitely.
same, yeah, the same time we have here Bihar Orthopedic Association Web Conference. Omar sir, are you going to Cairo?
No, really, I have no plan to go to Cairo.
Yeah.
That will be in what about the date? September.
1st and 2nd.
No.
1st and 2nd, sir.
Yes.
Yeah.
Okay,
I
but
got
if
an yeah.
okay, you got invitation, yes?
Yes, sir.
I have no idea about it really.
Same time we have the state conference here in Patna.
Oh.
And you are arranging the Assami Con India
Pune.
also.
Yeah.
In Pune,
So
yeah.
we are having this last. We just remind to everybody who are listening to us. Today we have the last date of early bird registration for Assamicon Pune. So we request everybody, all the audience, you can come. It's going to be a very interesting conference. Everybody, please get registered for Assamicon. Get membership of Assamese. It's a very good conference. When Palestine is joining us.
I visit
Definitely.
India twice. One time in Goa and another one in Solapur.
Great, sir. Great, sir. Paris is back.
Sir, you have to share your screen, sir. Once more, you have to share your screen, sir. But sir, can you hear me, sir?
Can you see? Yes. Can you see now?
No, sir, not yet, sir. It's coming.
Coming, sir. It's coming. So, do you have any alternate network or from mobile or something so that we can continue, sir? Besides Wi-Fi.
But sir, can you hear me, sir? I think the same problem is there.
Hello.
Yes, sir. Can you hear me, sir?
Hey. Ranveer,
Yes, sir. We can hear you, sir. Please.
can you see the slide now?
Not yet, sir.
No slide.
It's
Okay.
yes, coming,
This
sir.
slide
Yes.
is
Yes, sir.
visible.
Yes, sir. It is visible now, sir. Yes, sir. The slide is visible now, sir. You can proceed on, sir.
Hello.
So we can hear you, sir. We can hear you. Please proceed on, sir.
It says you can hear me, and can you see the slide?
Yes, sir. We
Wire
can see your
technique of
slide.
femur showing regenerate the bone.
Yes, we
Here,
can see it.
look,
Yes,
this is
sir.
wire
Yes,
technique
sir.
that I have put a lot of multiple console these are the console words. See, these console words. Only here is the olive femur. You can see the chances and the console words. So see the right side, and then finally you can see the before and after. So after doing 18 surgeries in 5 countries, the patient with the obese patient, 6 feet 3 inches, treated by Ilizarov. Okay, so this is the showing regenerate good bone. Now see how he is working. Gloomy face. Look at the thigh. That is, patient is very happy, and he sometimes phoned me. Now he's staying in Mogadishu. Okay, let us see the second one. 180 kg, comminuted supracondylar fracture, left femur with intra-articular extension. And you must believe me, before coming to my place, he consulted 17 orthopedic surgeons in Dhaka. Everybody is. Then he consulted to my place, and considering the age and weight of the patient, I suggested
Tanvi, you're right because sir has shown the importance of console wire here in this cases.
Oh, yeah, yeah,
Yeah,
sir is using console wires. So lots of console wires there. We are discussing about that. It's a very
because
interesting part. But
exactly.
though it is a very interesting topic, due to network problem, I think there is a network jamming in there.
Okay, okay.
see this is now you can see in the OT table. Look at the thigh.
Sir, we can't see your slide, sir. We can't see your slide, sir.
Nobody wants surgery because so fat and diabetic,
So
and at
please
the
share the
same
slide, sir.
time see the ring
Sir,
size.
we cannot see
How
your
I have
slide, sir.
configured this one. This
Yeah,
is the
please
big
come.
Russian one.
Dr. Tanvi, do we have alternate network for Bari sir? Any network for
Yeah,
him?
yeah, yeah. I think we have to set up the alternate network for him.
Yeah, that is very
Dear
good.
viewers, we'll take a short break and we'll come after this short break and definitely with another network is there. We want to take a short break of five
Okay.
minutes, 5 to 10 minutes, and then we'll come back again, dear viewers.
Okay.
Dear viewers, we have just make a contact with Professor Mofakrul Bari sir, and he requested all of us that he's facing a lots of network problem is there. So he apologized to all of you and give a scope to present in the coming Friday with this magical topic, that is the role of Ilizarov in obesity. So we are going to postpone our today's program, the Orthopedic Solution Academy, and the topic is the role of Ilizarov in obesity. And hope we will connect you with the same speaker in the same time in the same channel in the coming Friday. Till then, I would like to say bye bye to all of you. Thank you. Bye bye.
You are watching Rajtv, Jagorone, Bangladesh. Please subscribe our channel.